Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guests are Lindsay Shedek and Sarah Gates. Lindsay Shedek joined the Integrative Health and Hormone Clinic team in February 2021. She's passionate about health and wellness, longevity, and bioidentical hormone therapy. She received her Bachelor's of Science in Nursing degree from the University of Iowa College of Nursing in 2008. Upon graduating, she worked for 3 years as an ER nurse at Iowa's only Level 1 trauma center, where she gained valuable skills and knowledge in the healthcare field. During that time, she obtained her Master's of Nursing degree from the University of Iowa Nurse Practitioner Program, focusing on adult geriatric health. She's been practicing as a, this is what I mean. We can edit things. She's been practicing as a board-certified adult nurse practitioner since October 2011. In addition to her work with IAHC, she also practices part-time at University of Iowa quick care and urgent care clinics. From 2015 to 2020, she also served as the Director of Health Services at Coe College in Cedar Rapids, Iowa, working closely with the college-age population on health, wellness promotion, and mental health. She is proud to be certified through BioT Medical, a bioidentical hormone replacement therapy company for both men and women. Iowa natives, she and her husband Brian stay busy with their 4 children, ages 10, 9, 7, and 2, all of whom have deepened her understanding and commitment to living a healthy, well-balanced life. She enjoys running, hiking, reading, and cheering her kids on in all of their sports. Sarah Gates was born and raised in Iowa and lives nearby with her husband Justin, son Jonah, and her dogs Sherman and Zamboni. She began her career as a nurse in the operating room, spent several years in medical device diagnostic sales, and recently completed her degree as a family nurse practitioner, joining our care team in the fall of 2022. In the warmer months, you'll find her outside, walking, biking, camping, and kayaking. In the cooler months, she's most likely traveling to where it's warm. She loves spending time with her friends and family and is constantly planning trips and get-togethers with loved ones. She's also a certified bar instructor and also has a love for all things fitness, including attire. She's always been very passionate about women's health and preventative medicine and is eager to make a difference in helping you live your best life. Welcome to the show, both of you.
Thank you.
Thank you.
It's a bit difficult to have 2 guests on the show at the same time. So I'm going to try to direct questions to you guys each individually, just so we don't talk over each other. But if we do, that's okay.
Perfect.
So first, I want you ladies to tell me how you became interested in or how you learned about functional medicine. And Lindsay, since you joined our team first back in 2021, I'm going to go to you first. So kind of how did you become interested in this?
Well, I mean, I think I always sort of had an interest or a passion for the field, maybe before I even knew what the term meant, functional medicine, or what that world even really incorporated. But I think I've always been just very interested in wellness, staying active. And just as I progressed through my career working in urgent care clinics and conventional medicine, it became pretty clear that, I mean, as a whole, I mean, society is chronically ill and we keep getting sicker and sicker, and obesity rates keep going up. And I just thought, what are we doing wrong? Like, why can we not figure this out? Why can't we get these numbers to come down? I thought there's got to be something more. And then I really became aware of, integrative medicine or the field when my sister-in-law worked in the field. And so she, would talk about what they were doing when we get together for family functions and talk about these bioidentical hormones and how they were helping patients. And I think that then really fueled the fire. And then the opportunity was there for me to join the team.
And so for those of you who are listening, she's referencing Lindsay Shedek, who was our former medical assistant, who was a great addition to our team for several years. So yeah, that's kind of how we got used through her, which is great. Yes. What about you, Sarah?
Yes. Well, I feel the same way Lindsay does in that really I didn't know it was functional medicine that I was interested in. I just knew that conventional medicine wasn't really working and there was something more. So like so many of us in the field and so many of our patients too, my own health journey kind of led me to be more interested. So I developed chronic hives shortly after meeting my husband, which being on steroids for an extended period of time in a new relationship is not recommended. And it was debilitating. It was horrible. And I remember asking, of course, you're doing your own research, trying to find the root cause and asking my allergist, well, what about leaky gut? And I swear they looked at me like I had 3 heads, just not even really answering my question or explaining like that's really not what we do here, and maybe here's where you can go for help with that. So I just was kind of left floundering. So that's kind of where I think my interest peaked the most. And I've always been interested in women's health and hormones, like I said in my bio. So yeah, I'm happy to be here and be doing all the things that can really help
We
discover
may
the
have
root
to
cause.
we may have to come back to those hives in part of your story later if we'll see
Yeah.
how this interview goes for you.
Mhm.
But I'll go back to you, Lindsay. So as mentioned in
Yeah.
your bio, you spend part of your time in conventional medicine still, right? You're here part-time, you're there part-time, working in urgent care. So what are some of the key differences in how you approach your care there versus like here now, or how maybe has that morphed since you've developed some additional knowledge?
Yeah. I mean, urgent care, I would say it's a pretty targeted approach. And so,
Yeah,
I mean, I've got patients who are coming in for, acute problems like,
yeah,
sore throat, sinus infection.
yeah.
They rolled their ankle. And I think they come in with one problem. We're focusing on that.
Yep.
They're expecting, maybe a test or an x-ray, and they want to leave there with the solution, knowing
Yeah,
they're going to be
yeah.
better, in a week or two. Or whereas here, I mean, we get to dive in and really, it's a very broad approach. Like, we are going all the way back in their history. We're wanting to know everything, like, have you been exposed to water damaged buildings? Like,
Mhm.
we're going way back. We want the whole big picture. And then we, here, of course, we're trying to get to the root cause of a lot of symptoms that these patients have been struggling with for years, and just can't get feeling better. So they're very different. I do think that since working here and everything that I've learned, I mean, when I'm at urgent care now, I mean, there's a lot of opportunity to even just at least like put a bug in the patient's ear. Like,
Plant
okay,
a seed, plant a seed. Yep.
yeah, like, this is your fourth sinus infection of the year.
Have you
Why do
been
we think
exposed to
this?
water damage buildings?
Yeah. Is this a fungal issue? And so you maybe don't
Yeah.
need the antibiotic that you've been getting all the time. Prompt them to sort of maybe dig a little deeper, on their own. And then, of course, just prevention and like forward thinking, everything I've learned with like, longevity and how we can live a healthy quality life. Since I've been working here, that knowledge, I can talk about that at urgent care too, even though they're quick visits. But what are you doing for your immune system? Like, you keep getting these colds or viruses. Are you doing anything to help support your immune system?
I love
Um,
hearing that. I know you've mentioned to me
yeah.
before, even in passing, like, well, now I ask my patients, like, how much dairy do you consume? I mean, in 30 seconds, you
Yeah,
can ask things like, are you taking vitamin D? How much dairy do you consume? Right. So you're going to treat them for the
absolutely.
acute issue, but you also your wheels are spinning, trying to help them also in that short period of time get to the root cause of the problem, which really benefits them tremendously. So I think that's awesome. And
Yeah.
we need urgent care. We need conventional medicine. And I talk about that a lot. If you listen to the podcast, in my book, we describe the fire department, versus a carpenter approach. And so when you're in urgent care, you're more, practicing as that fireman or firewoman, right? Putting out that fire. But yet you also now have the knowledge of the carpenter, the contractor, that functional medicine approach. So I love that you're, trying to incorporate both of those.
Yeah, exactly.
We'll go over to Sarah. So Sarah, I hate even saying recent grad because we've almost been here a year now, but
It's still recent, right?
Yeah, still recent. Yes, you're a recent grad, and you've spent obviously a lot of time in conventional medicine. So, what are some of the biggest differences you see kind of here as compared to conventional medicine?
Yes, I would say I just find it very interesting in conventional medicine that they live in a land of absolutes. It's black or white.
Yeah.
So my example that I chose for this was hemoglobin A1C. If your hemoglobin A1C is 5.7, you're considered to be pre-diabetic. But if it's 5.6 in conventional medicine, that's fine. Like, yep, your hemoglobin A1C looks great. No problems. See you next year. Well, next year, guess what? Your hemoglobin A1C is going to be 5.9. You're going to be pre-diabetic, where there could have been things to prevent that all along. So I really like how we get ahead of that, right?
Yeah.
And I also think just the difference between how we interpret labs, which I feel like is kind of an unknown. It's a gray area to conventional providers, how we're looking at labs differently. and that we're looking at, Steph, you're frozen and it's throwing me off.
That's okay. Keep talking. Even though I'm
Okay.
frozen, keep talking. The
All
audio will
right.
be okay.
So I'll say, in functional medicine, we don't treat based on normal lab results, but we rather aim to optimize your labs, right? So that's kind of the hemoglobin A1C. There's even thyroid function. So repeatedly in my preceptorship, we would see, especially women coming in, I'm so fatigued, I'm gaining weight, I don't know what's wrong with me. Well, we would run a TSH and, maybe iron, ferritin, and B12 and folate. Well, everything looks normal. Well, really, they're not optimized at all. Everything may be normal, but that's not where you're going to feel your best. So those are the two kind of things that stick out to me.
I think, yeah, I'd agree. I think that's a strength in functional medicine, is that we're not just saying, okay, your labs are normal. We're looking for optimal. I mean, we all hear this. We have patients all the time that come to our office after having seen their primary care for years, and their primary care is trying to help, and she or he runs labs, and they are normal. So,
Right.
the patient has appropriately been told their labs are normal, but normal isn't optimal. There is very much a difference. And an analogy in my book I kind of show with a bell-shaped curve is, okay, if your kid got it, 10% on a test, right? Would you consider that great and optimal? No, you want your kid to get a 90, right? To get an A on their exam. But yet in medicine, if your thyroid labs are only at the 10th percentile, we still consider that normal and great. No, we want thyroid, we want sex hormones, we want vitamin D, we want nutrient status, all of those things high, right, in the optimal range. So yeah, and I wasn't taught that through conventional training, right? The difference between normal and optimal. So I agree.
Yeah.
Let's talk about some success stories. So Lindsay, I know it might be hard to pick one, but like, what have some of your favorite success stories been that you've seen through your time here?
Yeah, it is hard just to pick one. I think just in general, especially when it comes to the bioidentical hormones. So getting women and men, their sex hormones optimized, they come back and they feel so much better. And it's so rewarding to hear that from them, that like, I don't have this lingering fatigue. My mood is better. I'm just, energized, my brain fog is gone. It's all of these things that have just been these kind of chronic symptoms that they've never been able to figure out. So I think optimizing hormones and seeing how much better patients feel, just in general, it's really rewarding to be a part of that.
We do a lot of that here. And I think that's one of the first things we do, because optimizing hormones is such a big needle mover, right? You get the patient sleeping better and with more energy, and suddenly they're more motivated. They will change their diet. They'll go do that weird Prolon or liver detox thing or whatever, right? The hormones, just improving them really is life-changing. So I would agree there. What about Sarah? What would you say?
Well, I have to echo Lindsay that it's so rewarding. It's not uncommon for me to be texting Steph or Eric, like, oh my gosh, I love my job. Like, this is what I heard from a patient today. And their lives are so changed. I hear, you have saved my marriage. My husband is so happy. He said just the other day, a patient told me, like, my husband said, I'm even more affectionate than I used to be. So just getting people, and I get goosebumps when I talk about it. And I also love, so this is a close second to saving marriages, is having the little ladies that come in with bone density problems, osteoporosis, osteopenia, and they don't want to do the medications with all the terrible side effects, right? Or infusions. And they start getting hormone replacement therapy, bioidentical, that we provide for them. And we watch their DEXA scores improve. And it's just great to watch them build bone, and they're happy and no side effects, right? Very minimal.
I agree. I've said it on the podcast so many times that I've never seen anything improve bone density like hormones can, and specifically hormone pellets, and even more specifically testosterone. Yes, women need testosterone. So I love it when patients bring in me the DEXA and they're like, I'm not quite sure what this means. I think this says I have an increase. I'm not sure, and then I show them this is statistically significant, right? And they go back to their doctor, and their doctor's like, what have you been doing? And they may or may not share that they've been on hormone pellets, but typically you can't argue with results. So that provider's like, okay, whatever you're doing, just keep doing it because it's working, right? Without the side effects of a lot of those other medications that have minimal results. So I would agree on that too. Is there any message that you guys would want to share with, our friends in conventional medicine who may be listening to this podcast? Someone who maybe knows, oh, suddenly you're working in this weird functional medicine clinic. Like, is there any message in specific that you would like to share with them?
Go for
Lindsay,
it, Sarah.
sorry, go for it, Lindsay.
Oh, you have
either or. Yeah.
Well, I've been blessed to be able to keep in touch with some of my preceptors and kind of like explain some of these things like optimal lab values. And so they're kind of starting to understand, and then we do see the referrals come through. But more than anything, I just wish for the patient's sake that we could collaborate more and not so much live in a world of absolutes. So I just feel like so often patients come and they've talked to whatever provider they've been to who doesn't either understand or approve of, non-FDA approved treatments or hormone replacement in general or functional medicine. And it almost feels like because they didn't learn about it and aren't familiar, that it's not right. It doesn't exist. It's wrong. Right. I've heard there's no studies supporting that type of hormone replacement therapy, which is absolutely false.
A lie. Yep.
Yes. And so let's just say, like, I'm not very familiar, in that realm. I know there's people in town that do that, someone that I can, at least provide you the information so you can get the help that you deserve, right? Instead of just saying like, no, that's wrong. That's not how we do medicine, because there is a different way.
Yep. Well said. Lindsay, anything to add to that?
Yeah, no, I mean, I agree with Sarah. I think, if we can get to the point where we're working together, I think that would be so awesome. I think we could just offer patients so much more, and just, respecting one another and knowing that training education that we had was different.
Yeah.
And so, I don't expect them to, immediately jump on board with something that they've never heard of before, but at least being open-minded to it and knowing that, gosh, maybe I should look into this. Maybe there is some research, there's something to this. So.
Yeah, I think a lot of providers are just uncomfortable with what they're unfamiliar with because they haven't been taught it. But if they would be open, to your point, we can provide the studies. Trust me, they're out there. I have, we have folders and, on our shared drive, just articles on whether it is hormones improving bone density or reducing cardiovascular risk or whatnot, right? And then being safe, right? We have those pieces of information if others would be, open-minded enough to take the time to know the research is there. We just have to find it. And I think absolutely working together would be to the betterment of all worlds combined, us, them, the patient, right? I mean, many times we just want an open-minded primary care who can do their annual exam and bill that to insurance because we don't bill it to insurance. But some of our patients are uncomfortable even going to their past doctor because he or she has poo-pooed their supplements or their hormones or whatnot. And I just wish there was more of an open-mindedness approach there. If there's a curiosity for anyone listening, we'd be happy to take you out to lunch and talk to you about what we do here, because what we do is evidence-based, and hormone replacement therapy specifically even can be done safely and effectively for sure.
I'm going to add to that.
Yeah.
If I can real quick. So I've been like, as a new provider, I'm all gung-ho about getting new patients and becoming friends with all the conventional providers. So I've been like sending thank you notes to those providers that do send their patients here.
Which is awesome.
With the permission of my patient, and of course, keeping their information confidential, sending messages or notes to providers who maybe are questioning it. So I think the part that's really frustrating is when we're treating someone for mold toxicity and they're so sick and their physician is not approving of, like, even recognizing, that that's a thing. So I've gone so far as to reach out and provide the CDC website on a specific mold the patient tested positive for, and like, this is an actual real thing, that we're helping this patient overcome. Would love to collaborate with you on their treatment.
Yeah, I applaud you. You've done a really good job trying to network with other local, conventional providers, because I've just been burned in the past, so which I've told you, from some. So I know you're eager, and I'm just going to let you continue that excitement and continue to do that. And we can send my book as well. I think that's a great outline. So that's a great gift. We'd be happy to send anyone listening. I mean, why do you think, maybe we already answered this, but I was going to ask, why do you think some of the conventional doctors aren't open to what we do? I mean, is it what we've already answered? Like, is it just the lack of knowledge? Or why do you think they kind of poo-poo what we do?
I think so. I think it's just not knowing, not having been exposed to the research or the literature that's out there. I mean, they weren't trained on some of these things. Yeah, I think that's a big piece of it. And I mean, they're busy, right? Like every practitioner provider is busy. So
Yeah.
to say that they've got a ton of free time that they can try to dive in and explore some of this, I mean, that's hard. I understand that too. So especially once, they've been in their practice for a while and they are doing things the way they've been doing things. I mean, it takes, a lot of effort and time, I think, to try to open up and incorporate some new ideas or new things. So yeah, I think just not having the education and training and exposure, I would say. I think if they're able to see the research and the literature and hear the patient success stories, I mean, I don't know why they wouldn't be on board with that.
Yep. I think sometimes their time is very limited, right? They have to see
Yeah.
so many patients a day when we see fewer than, most of our colleagues in primary care, whatnot. So I think their time may be limited, but it doesn't mean that they necessarily have to learn all of functional medicine, but just know when the appropriate maybe referral is, right? If they can't get that patient's
Right.
skin to clear up that eczema, that acne, and they've tried medications and whatnot, might there be a diet change or supplement or, something else that we could help with? Yes, the answer is yes. So again, I think just knowing when to refer out would be great because there's a good chance that we can help.
I think they are slowly catching on though too.
I
Like
do
I'll
too.
hear more
Yeah.
and more like avoid dairy, right? For eczema and acne
Yep.
and some of that sinus stuff. Or I had one patient the other day tell me that her GI doctor told her to avoid gluten and dairy. And I was like, that's
Wow.
awesome.
Yeah.
Cool. I just think it's, all the things you said.
Maybe can we go back to your hives, Sarah? So and you just share whatever you're
Please don't
comfortable
take
with,
me
but
back to my hives.
how did you approach this previously, right? Like what did you do for your hives back then? And knowing what you know now, maybe how would you have approached that differently? And ultimately have those hives improved? Like, where are you?
My hives are gone. So no hives. How would I have approached it differently, or how did I approach it? Was that the first question?
I mean, both. Like, what did you do
Yeah.
back then? And then
I
how
mean,
many
back then
you,
it was desperation. I would almost get these flares where it would be so bad that it would require a round of steroids. So then, of
Yeah.
course, the weight starts piling on, right? I'm this angry, emotional, chubby beast and not feeling well at all. And then I ended up on like immunosuppressant therapy and
yikes.
getting labs drawn to make sure my liver function was staying up to par monthly. Yeah, just chasing symptoms really. So how would I approach it differently? I mean, I would have dug for the root cause. So thinking back, for a long time, I thought maybe it was my breast implants that were causing the
Yeah.
hives because
Yeah.
I had them removed. And then the hives went away. I also think could it have been mold at the time? I told you I met my husband. We ended up, getting married. I moved in with him, and I wonder if he lived in an older home. Could it have, I mean, they didn't start until I met him. So could that have been the issue too?
Well, I'm glad
could have
they
been a
cleared
number
up.
of things. Yeah, me too.
Yeah. I mean, ultimately, I'm glad they cleared up, but I think you're definitely onto some things there. And luckily, hopefully, you did remove yourself from that potentially moldy, environment, and you got the implants removed, so your immune system was less triggered, and things took care of themselves. It sounds like.
Right.
Let's go back to bone density. So I just want to ask Lindsay, how you would approach improving bone density, knowing what you know here, versus maybe what you would have been recommending, 5 years ago in a primary care setting, whatnot.
Yeah.
Because I think there's some key things we do here that are different.
Yeah. And Sarah mentioned it a little bit earlier too, but optimizing hormones, I think is a huge part of the bone density. Like she was talking about, seeing improved scores on DEXA scans. And so testosterone is an excellent hormone to help build the bones up. And then estrogen as well. I mean, when you think about postmenopausal women who have low to, maybe no estrogen there, they're the ones that are an increased risk for developing osteoporosis. So, I mean, it makes sense that we need to optimize those hormones to help our
sooner
bones.
the better too. Yep.
Right. But the other big thing is just looking at nutritional deficiencies. Like, are you taking any supplements right now? You're probably not getting enough of what we need for nutrition just through foods that we're eating, unfortunately. We do have to supplement. A lot of people, when they think about bones and taking a vitamin, they think, oh, calcium, I've got to be on calcium. And it's true, calcium is very important for bones, but also magnesium. And I think majority of the population is probably magnesium deficient. But we think here, and we believe there's common recommendation that the ratio of magnesium to calcium that we need is actually 2 to 1. So just looking at them, we can do testing, even nutritional analysis, to see where they might be deficient in some of those things, and then helping them get on the right supplements. Vitamin D is another huge nutrient that we need for bone health, along with vitamin K2, which so many of my patients, I don't feel like I've ever even heard of vitamin K2, but that is a super important nutrient that helps improve calcium absorption. And so I think the nutritional aspect is huge when we think about bone density, but also optimizing sex hormones.
Totally agreed. Yeah, your bones need more than calcium. I feel like so many postmenopausal women are just put on calcium. That's it, if they're lucky, vitamin D. But how about we test your vitamin D levels and we test your mineral levels? We can look at vitamins, minerals, amino acids, antioxidants, omegas, right, to see what your nutritional status is and then give you those appropriate supplements. So I totally agree. Many times those supplement needs boil down to gut health and like gastrointestinal health, because if your gut's a mess, then you may not be properly absorbing your nutrients too. So that's a good transition to my next question. So Sarah, how would you approach different kind of gastrointestinal symptoms here? Because we optimize a lot of hormones here, but we also see a lot of GI symptoms. So how would you approach that here? And maybe how that is that different from your primary care training?
Sure. Well, I think in primary care, to start there, it's really just, what are your symptoms? You have reflux. Okay, here's a pill for that. Well, then I think that's really what gets me not nervous with the new patient, but you see that they've been on a PPI, like omeprazole for a long time, and that that's affecting their bone health. It's affecting their gut health and their ability to absorb nutrients. Like, can we just peel back the onion and figure out what's causing the reflux first, fix that, and then maybe we won't have all these downstream effects from the medication, right? So starting with food sensitivity testing, that's always, the first recommendation that we make to patients, I think, as a whole, beyond just the normal serum lab testing that we order for their hormones. So working to identify what foods are causing some of the issues that they're having, what's causing inflammation. For the patients that opt out of the food sensitivity testing, I then just encourage them to do elimination diets, right? So we know that the four most inflammatory foods are gluten, dairy, sugar, and eggs. So just working to take those out of the diet, kind of keep a journal of how their symptoms feel. That can be life-changing. I mean, for much more than just the GI symptoms, right? We see skin symptoms resolve with that. We see joint symptoms resolve with that. Even anxiety, a good share of our neurotransmitters are manufactured in the gut. So that can really have an effect on your mood as well.
Totally. I'm going to keep probing you here, Sarah. Like, what else can we do? So that is wonderful. And I would say 75% of the time, that's going to help patients. But what happens when they've changed their diet and that's not enough? Like, what else can we do? How else can we approach gastrointestinal symptoms here?
Yes. So then we dig deeper, right? So it kind of depends on what their symptoms are. We see, a fair amount of SIBO, and SIBO can be so refractory. So that's something that we can consider in patients. And then one thing that we, unfortunately can't test for is CFO, so fungal overgrowth in the small intestine, which, we think too could be a problem causing, if they've done all the right things and they're still having the bloating and gastrointestinal distress, that maybe we need to do more of like a yeast and bacteria cleanse to get rid of some of the overgrowth and treat, the source of the problems.
So you mentioned SIBO, which for the listeners is small intestinal bacterial overgrowth, which I have a whole podcast on. Highly recommend you listen to that. I can post a link to that in the show notes. And then CFO is small intestinal fungal overgrowth. But our bacterial yeast cleanse treats both the bacteria and the yeast. So it's just more of a diet and supplemental regimen that takes a couple months, but can be very effective. Although we also do prescribe antibiotics and antifungals when we need to, right? Sometimes we need them. And so I'm glad that we have that as another tool. We can also explore other gut infections via stool tests. So we can actually look, like for the patient who has reflux, right? We can look on their stool test to see if they need enzymes or ox bile if they've had their gallbladder removed, or hydrochloric acid if they can't digest the protein. So we can explore that, and we can even explore fructose intolerance, right? There's just lots of different, like you were saying, we can dig deeper, lots of different, layers, I guess, that we can peel back if we need to. And sometimes it's just patients are eating foods that are laden with toxins. It's not even the food itself, but it's that they don't eat organic. They're eating glyphosate, laden grains, whatnot. So sometimes just getting them to change their diet, start eating organic, at least for the dirty dozen foods, can make a big difference too. So there are lots we can do for GI symptoms here. I feel like we also see a lot of neurological symptoms, right? Because like headaches are a common concern. So, Lindsay, how would we approach neurological symptoms here? Like things like headaches, paresthesias, tremors, autoimmune diseases, right? What's our approach, and how is that different? Explain that to the listener.
Yeah, I mean, I think again, nutritional deficiencies. I think we always sort of start with the gut, because gut health is so important. But looking at the gut and then nutrition are two of kind of just the first two things that we really want to make sure we're doing right. Yep. A lot of times with headaches, there's again some magnesium deficiency. But I think also really diving into what are you being exposed to? You'd mentioned like endocrine disruptors. What toxins are in the home? What are you putting on your skin? What are you eating? Are you living kind of that clean life where you're avoiding fragrances and eating organic? All of those toxins, I mean, everything can build up in the system. And so we talk a lot about detox. We of course have a detox, like a 7-day, 14-day, there's different detox plans, talking about sauna use, just letting your body sweat, like getting some of those things out of the system that could be affecting your neurological system. And I think adrenals too is always important to think about adrenal health and the stress response. So many patients, I mean, so many of it, it's just, there's always stress. You're always like in fight or flight response. And so trying to focus on the adrenal health as well, and spending time, talking about the autonomic nervous system and how can we live more in that world versus that flight or fight stage.
And it's hard to do that in 5 minutes, right? Like the average time spent with a doctor is like 5 to 7 minutes. It's like, how can you say hi, ask their problems, figure out what labs you need to order, and like treat them in 5 to 7 minutes? Like you can't do that. That's why our appointments are longer, and it just takes, to do this, it takes more time. So yes, I totally agree. We got to reduce gut and neuroinflammation. We got to fix nutritional deficiencies and help the patients detoxify, reduce stress, and optimize hormones that we obviously have heavily emphasized through this show. So yes, and yes. So how many clients do you guys think you've had here that have actually had gut inflammation and food sensitivities?
Everyone.
Or should I say, how many have not had?
I mean, I think probably everybody. Yeah. I think everybody has some sort of gut inflammation, whether they truly have leaky gut or unless they've really, if they've already been seeing a functional medicine provider, or they've, educated themselves on some of this and they've been living a very clean anti-inflammatory life. I mean, which is not many. So I would say everybody.
Everybody, yes. How many have hormone imbalances, would you say?
A lot.
Agreed. And how many have nutritional deficiencies?
Everyone.
So if you're listening to this podcast, you probably have gut inflammation, hormone imbalances, and nutritional deficiencies. And those are kind of the foundational things. Even as we brought you guys on board, those are you ladies on board. Those are the first kind of 3 foundational, steps in the longevity blueprint that you learned how to fix, right? Then we can dig deeper if we need to, and we can explore mold toxicity, right? Not everybody has that, but some people do. So once we get those first few layers, first few steps of the blueprint in place, then we can really decide, do we need to dig deeper, right? Or not? Because the large majority of the time, fixing kind of those 3 steps helps the patient tremendously. I know we've talked about this a lot, but obviously a highlight of our clinic, since our name is the Integrative Health and Hormone Clinic, right, is optimizing hormones. So would you say that prior to coming to our clinic and had further training, you both are certified as am I in BioT, pellets? Would you say prior to coming to this clinic, did you know how heavily hormones influence like so much in our bodies?
Not everything, certainly. No.
Do
Not
we,
everything I know now.
Lindsay?
I was gonna say I had no idea. I mean, I think there's, the obvious. I think a lot of people know that, well, women, especially perimenopausal and menopausal, we just sort of know like, well, we've got no hormones, our body's done with that, and this is the way life is now. I'm just going to have those night sweats and fatigue and all the things we associate with menopause. I certainly had no idea, how bioidentical hormones could help, and that they were safe. I mean, yeah, there was a lot that I didn't know before I started here, and of course went through the BioT training as well.
Sure. Let's break down for the listeners too. I'll kind of separate this, but I'll stick with you, Lindsay, here. What are some symptoms of low thyroid? Because we see a lot of patients who, again, like their thyroid hasn't bottomed out, right? Their TSH isn't through the roof and their T4 and T3 aren't super low, but they're low end. So what are some symptoms, Lindsay, of low thyroid that you see here often?
Yeah. When I think of low thyroid, the word that comes to mind is sluggish, just slow metabolism, just kind of that blah feeling. They're a lot of times feeling cold all the time. Constipation is usually an issue. Weight gain or trouble losing weight. They can't lose weight like they could, 5-10 years ago. Dry, coarse hair, dry skin, just kind of that low energy overall, kind of low, slow metabolism. Thyroid is one of the first things we think about when patients come to us, just because so many patients feel fatigued and like they can't lose weight. I mean, those are some of the main complaints that we see. So really looking at the thyroid is one of the first things we do.
And then how do we look at the thyroid? So like what labs, Sarah mentioned earlier, you have your TSH run. Well, 90% of the time the TSH is fine. Yes.
Yeah.
So what makes our clinic different? Like what labs have you learned to run here for assessing if thyroid is sluggish, low end?
Yeah, I mean, I tell patients we're going to run like a thyroid panel, right? So we'll check the TSH and the free T4 and the free T3, along with, sometimes a reverse T3 and then thyroid antibodies as well. Usually in conventional medicine, like you were saying, they'll check the TSH, and if that's abnormal, they'll reflex it to then check a free T4. Well, we know that free T3 is the active form of the thyroid hormone in the body, and so we check that lab. We can check that easily with the blood draw, and again, we treat based on that, but also on how the patient's feeling. We take both things into consideration. So yeah,
agreed. We just have a more thorough approach for sure. Okay, let's transition to you, Sarah, and talk about sex hormones. So what are some symptoms of low sex hormones? And then I'll ask you the same thing, like how do we maybe approach that differently? Like what labs are you assessing here?
Yeah, well, so signs and symptoms of low sex hormones are all the things that make a marriage miserable, right? So low libido, fatigue, sleep disturbances, body composition changes, low mood, brain fog. I mean, I hear irritability all the time. So all of those things are definitely sex hormone related.
And I'm going to break, that was a good answer. I'm just going to break this down for the listeners. This is at least what I rattle off to patients. So symptoms of low estrogen can be hot flashes, night sweats, vaginal dryness, memory fog, right? Like a woman walks into a room and she's like, why did I walk in this room? What was I going to do? And then symptoms of low progesterone primarily, which can happen even in women in their 20s and 30s, right? Heavy periods, PMS, anxiety, poor sleep, whatnot. Symptoms of low testosterone, poor mood, motivation, drive, libido, muscle mass, energy, whatnot. So yes, patients tend to feel better and relationships are better when all the sex hormones are higher.
Right.
So
and I also would,
go ahead.
I would also tie in the labs, right? So this comes up so frequently that I just have to mention it because we hear all the time that women especially will go to their physicians and like, please, will you run my sex hormones? I just don't feel right. Like something is not right. Well, everything comes back normal. And here we are back to the normal versus optimal conversation again. And so when I explain this to patients, I tell them like the reference range that's in that laboratory testing is merely an average of every woman your age who's had this test run. So congratulations, you're just as miserable as everyone else who's, in their 50s as a woman. And that's not where we want you to be.
But and literally, if their progesterone is 0 and even the estrogen is like 0, they are told that's normal.
It's
Having 0 hormones is is not optimal.
It's maybe normal, but it's certainly not. Yeah. It's not desirable, that's for sure.
Right, totally. So how do you approach the question, when patients come in, and obviously we're heavily advocating for checking hormones and then optimizing them if found to be low? How do you answer the question that we get asked all the time here? Like, don't hormones cause cancer? Are they safe? Can I use these long term? If you both want to chime in here, how do we answer that question typically?
Well,
yeah.
I was just going to say, I love Stephanie's quote on this. So I will say that pretty often that, if hormones caused cancer, we would have a bunch of teenagers running around with cancer and a bunch of, 90-year-olds without it. And that's just not the case.
Yep.
And then I know Lindsay does a great job too of explaining the Women's Health Initiative. So I'll let you take that.
Yeah. Yeah. I tend to go right into that. Like, why this thought even came about. And it was from this WHI trial that was done years ago. And it scared all patients and providers away from using hormones at all. And so I think that's where this first started, was using hormones. Oh gosh, you're going to get cancer. I mean, there's going to be all these bad outcomes. But I just explained to them that this trial, they use synthetic hormones. We don't use synthetic hormones. We use bioidentical. They're most molecularly similar to what your body naturally makes. And so we're not putting anything synthetic in you. That study also used oral estrogen. We don't do oral estrogen. So there's some big differences there. I mean, there's, the studies are there that natural hormones actually reduce your cancer risk. They reduce cardiovascular risk. They help with brain health and preventing Alzheimer's disease. And I always offer, if they're concerned and they want to see the research. I mean, we have more than I could even, so many studies that we can share with patients. And that's reassuring to them, I guess, to hear that too.
Totally.
And
yeah.
Clinicians.
Yeah. And to clinicians listening. Yes. Because I know your friends are going to listen to you. So I always tell patients, we cannot compare that study to what we're offering at the clinic, because that's what we try to do, is not mimic what was done in that study. We don't give the synthetic, oral estrogens, right? Or progestins. We're giving natural bioidentical hormones through a different route of absorption. And we've talked a lot about the pellets today, but we do offer other things. If someone wants a topical gel or cream or a patch or a sublingual lozenge or oral capsule for the hormones that those are safe for, we offer those as well. So we're not just a pellet clinic here, but to be clear, the pellets are the Cadillac of hormone replacement therapy, and most patients really do love them. So yes, good answers there. So another strength in our clinic is also offering advanced cardiovascular testing. And I probably run more of these than you guys do. So I hate to putting you on the spot, but I do want to ask if one of you guys can share with us, at what point would you recommend this sort of advanced testing to our clients, and kind of what this testing entails? And I'll answer this question too. So I don't know who wants to take that.
Yeah, I haven't ordered a ton of that, but the Boston Heart Health test is what we do, and it's so comprehensive. It's just goes very in depth in looking at small particles of triglycerides and cholesterol, and I think we get to that point of recommending that for a patient. Through symptoms that they're having in their past medical history, but also family history is a big part of that decision too. If they've got a parent or a sibling who has cardiovascular disease, had a heart attack at a younger age, or, have always had high cholesterol, I think it's important to offer that testing so we can try to stay ahead of these things and maybe start some measures now before our patient gets to that point.
Helps identify the risk, right? Absolutely. Yes.
I also get a lot of patients that are they just don't want a statin. So I have high cholesterol. I really don't want a statin. What else can I do? And the conversation is like, we can try lifestyle, maybe some citrus bergamot, see if that does the trick. If not, let's move to this advanced testing so we can see, is your high cholesterol because of overproduction by your liver, or is it because of overabsorption by your intestines? And that cues us in a little bit more on how we can treat that and what kind of therapy they would respond to without just, kind of throwing things at the wall to see if they stick, with side effects and all of that goes with that.
Totally. Yeah. I have even some young patients who come saying, I've had high cholesterol my whole life. My doctor wants to put me on a statin. Like, what is your opinion on that? And usually I say, well, let me see your numbers, but let's also run this fancier test to kind of see, of those numbers, do you have the atherogenic particles, the really small particles that are going to, attach to your vessel wall, form a fatty streak, and then throw a clot, right? We want to know if of their cholesterol, if they have small, dense LDL, or do they have large, buoyant LDL particles, the ones that just don't cause a lot of problems. And we want to assess inflammatory markers. So we can do that on the test. We can even run for someone who maybe actually does need something heavy like a statin. We can assess their genetic risk for responding to that gene. So it's called the statin response gene, to kind of see, are they likely to have side effects? Is this likely to work on them or not? And then, like you said, Sarah, yes, we can look at the absorption markers to kind of tell where the problem lies. So a lot of patients overproduce cholesterol in the liver, others are reabsorbing it in the gut. And then if we know that, we can then implement strategies, supplement, or medication, and we still use medication at times, right? To help address that option or that concern. As I'm talking to you guys, I'm thinking about, and we also help the patients lose weight, which makes me want to ask you guys about semaglutide, because that's very popular. And I know you've done a lot. I'm going to keep on you, Sarah, here, because you've prescribed a lot of this here. Do you want to, for the listeners, just give, we could do a whole podcast on semaglutide, but we won't. Let's just do like a short snippet here on what semaglutide is, how it's helped your patients, kind of go over side effects, kind of give the listeners a little spiel, because obviously if we can get them to lose weight, that can impact their cholesterol as well. We have so many patients who just feel like, I'm stuck at 150 or I'm stuck at 175 or whatever. They can't, kind of bust through that. They can't lose weight. So this is a very valuable tool that we implement after we have done the food testing, optimize the hormones, help them detoxify their body, right? This is a tool that we use on top of our functional medicine approach. So what is semaglutide, Sarah? Tell us kind of how that has helped your patients.
Yes. So semaglutide, the reason we love it is because it mimics something that our body already has. So it's a GLP-1 agonist. GLP-1 is the hormone or peptide that's responsible for signaling to your brain that you're full and shutting off hunger cravings. So I've even heard this that semaglutide was used in a positive light for people with eating disorders, which you would think would be kind of counterintuitive, but I hear so often that it just shuts off the food chatter. You're not thinking about your next meal. You're not, obsessing over food. So physically, it slows down your gastric motility, so you feel fuller sooner and stay feeling fuller for longer. So because of that, the number one side effect that we see is constipation. So something that, definitely we're already working on if that patient is predisposed to that or already struggling with that, but certainly want to keep those toxins moving out of your body. And I will occasionally have patients experience nausea. However, I think that's dose dependent, quite frankly. There's been a little bit of bad press from some celebrities. I was so nauseous, I couldn't function. And I think you were just on too high of a dose then.
Right.
Don't always need that high dose to be effective.
Agreed.
And then I always tell patients what I really love about it, especially for those that have a family history of diabetes or personal history of gestational diabetes or are already insulin resistant, is that it almost helps to reverse the clock in a sense where it helps the pancreas to create more beta cells. So helping with insulin production and really, hopefully long-term helping with that too. So it kind of gives us like a crutch while we're working on lifestyle interventions.
Yes.
I think, and I love it. I can't say enough good things about it.
I have to address what some of the naysayers, are thinking right now, because some patients will go home. Sorry, I'm going to take a drink here. And, they'll research this online. And they'll say, well, the trials show 2/3 of the patient who eventually stopped the medication after having lost weight, gained all their weight back. And my, rebuttal to that is, well, those aren't my patients. Those are not our patients. Right. Those are the patients who all they did was take the drug I mean, that's what it shows. Like they just took the drug, they lost weight, and then they stopped taking it, and 2/3 of them gained the weight back. Not all, only 2/3, but still 2/3 is a hefty amount. So I would like to think that is not what is going to happen to our patients, because again, we've plugged all these other pieces of the puzzle in first before we add that additional tool. So I think, and now that we've prescribed this for over a year here, whatnot, I can't just say I think, I know that we have had good success long term. Now, some patients want to stay on a really low dose, like maintenance, and maybe that's just placebo, but generally speaking, we've had really good success with this. So it's been a helpful tool. And I only say Sarah prescribes it more because you're full time and Lindsay, you're part time. But do you have anything to add to that, Lindsay?
Sarah, you did a great job explaining it for sure. Yeah, I think it's kind of like in a sense, it's kind of like the hormone therapy or the testosterone. It's once we can help that patient get like that initial weight off, like just bust through that door, then it's like they're feeling better, they have more energy, and then that just continues on, right? They're more motivated to eat healthy, so that when they come off of the semaglutide, then they've got some of those habits in place and can continue.
Yes. Okay. I'm going to get a little personal here. So I'd like to hone in with both of you guys on how your personal health has changed for the better since kind of learning what we do here. So like in essence, do you guys take supplements? What is it that maybe has changed with you or your family? Can you share with us some lifestyle changes you've made? And some things, of course, are personal. You don't have to share like too personal things. But Lindsay, I'll have you go first. Like, did you used to take supplements, and do you take them now? And what's changed?
Yeah. A lot has changed. I didn't take much for supplements or vitamins prior to working here. I mean, honestly, like, if I had something in the cupboard or, a generic multivitamin or vitamin D, when I thought of it, I would take it. Unfortunately, I did not pay attention to like the quality of the vitamin. I wasn't aware that that was such a huge piece, that you need to make sure it's coming from a good source. There's no like additives and fillers and all the things. And so I've learned a ton about that since working here. I take supplements every day now. Some of my favorite ones would be mitochondrial complex, which we call that the Cadillac of multivitamins. And so it helps with energy, but yeah, it's just a good, well-rounded multivitamin. And then magnesium, I talked about magnesium earlier, but that has a very kind of calming aspect to it. I mean, it helps with hundreds of processes in the body. But one thing, it's nice to take it before bedtime because it has sort of a calming nature as well. And then omega-3 in fish oil, that's another really important one. Other things, gosh, kind of
have you changed your diet at all? Is there anything else?
Yeah.
I remember like your first day of work, just kind of what you were having for breakfast.
Yeah. I remember telling you what I had for breakfast too. And thinking I was doing a great job eating these, crackers, whole grain, so with peanut butter. And then it's like, oh gosh. I mean, I have changed my diet. I can't say it's been 100%, and it's a work in progress for sure, but just knowing that, inflammatory foods, like we mentioned earlier, the gluten, the dairy. I mean, I definitely have way less. And I'm very conscious of that. And I've also, it's had an impact on my kids too, and what they're eating, what I'm buying at the grocery store. I mean, paying attention to, what is this organic, is it GMO, like just so many things. The other thing I think since working here that I've realized too, how important detox is. And I absolutely love using a sauna. I've always enjoyed exercise and working out and sweating, but being able to go into a sauna and sweat and just know that I'm detoxing and getting rid of some of these toxins and chemicals. That's a great feeling. And so that, and then in hormone optimization as well, that's helped immensely with so many things, but especially brain fog and energy. So things have changed for sure. And just sleep too. I feel like I could go on and on, like stress reduction and sleep, and realizing how that's important. Like if you're not sleeping well, nothing else is going to work for you. I mean, we've got to prioritize sleep. So
Totally.
Yeah.
I will say for the listeners too, we do have a sunlight and sauna here. So if you're a patient the first time, you can come use ours for free. Obviously, it's not convenient to like come sweat here like every day or whatever, but eventually you can certainly purchase one for in-home use, and we have codes for discounts for purchasing a sauna. But check ours out. You certainly can use it. See what that's all about. I think what is one of the most rewarding things for me. Obviously, I love working with patients, but like we've had so many employees over the years, and I feel like that's kind of a responsibility of our business, right? To take care of our employees and their families. And so I feel like that's one of the things that is most rewarding for me is when I hear like, and the health of my children, like literally is going to change because of the knowledge have and the choices you're making with the food you're putting in your bodies, right? Because you're buying their groceries. And like just for me to hear it's that butterfly effect, that ripple effect, right? With the employees we've had and the family members, their children, their parents, whatever it is, right? That they have now really educated on just good, wise decisions on nutrition. Like for me, I don't know, there's just something special about that I feel like, yes, our message is, being spread to the masses, not just with our patients, but with all of our employees. So I love hearing that. You have 4 little kiddos. You got a big
Yes.
No pressure. What about you, Sarah? What would you say?
Oh, what was the question?
Well,
How has my life changed?
What has changed? Like I was just kind of joking with Lindsay just because I knew the little biscuit thing she had when she started for breakfast when she started working here. But like, what has changed with you? Like, and even for the better. And that's why I was just asking, did you used to take supplements? Do you do now? Like, what habits have changed?
Well, I remember in one of my first meetings with Thomas, our orthomolecular rep, he asked me, what vitamins I was taking. And I said like some gummy multivitamin from Costco. And I think he almost fell off of his chair, because you just don't know what you don't know. And I didn't know. I would fall for every marketing gimmicky thing that this little round gummy vitamin is going to take care of your hormonal acne. And like, it didn't, none of it really worked anyway. And it's kind of hard to know what exactly to do. So it's nice to be able to give patients directions and then give my family direction as well. So yes, certainly I have what I call my core 4 and then magnesium. I really should call it my core 5, but it doesn't rhyme. So, of course, all the orthomolecular, your longevity blueprint products. So mitochondrial complex, omega-3s, vitamin D, what am I missing? Probiotics, and then magnesium. I love the magnesium calm at night. The gummies are great. So that's kind of in my list of what I take for supplements. And then my husband now has his own little supplement pill organizer too, and faithfully takes what he's told to take. Still working on my 11-year-old for that, but he doesn't like to take all the things, but certainly have changed our diets too. So trying to kind of sneak out the gluten, right? So finding the spaghetti noodles that are gluten-free, that don't taste gluten-free, that, we can trick the family into eating. And my family really loves soda. So we were buying soda, by the case before. And now I've got them to kind of shift it over to the Olipop. And we talk about the importance of fiber in our diet. And did you know an Olipop has 9 grams of fiber in
I know,
can?
it's nuts.
It's crazy.
I didn't know that.
Yeah. So some slow but sure changes. I mean, we certainly aren't perfect either. We still love our ice cream treats once in a while. And, it's hard to avoid gluten altogether. So definitely live a real life, but try to do the best. And I think, honestly, one of the biggest eye-opening moments was just when I started looking for those endocrine disrupting chemicals. And like, I thought I was using this great aluminum free deodorant and it was not great at all. My lotion was not great at all. So just kind of cleaning up some of the personal care products. I think that makes me feel really good. Like that was just junk. I can't believe what's allowed in our products.
Yeah.
Well, I loved it here. And I wanted the listeners really just to hear that you ladies are practicing what you preach to, right? And that this is a journey. It's not like one day everything changes and I'm never going to touch sugar again. And I'm never no, you have your lives, but you've made shifts, you've made changes, you're learning. This is a journey. And I think that's what makes this very doable. So thanks for sharing. So what would you guys say to our listeners, so not providers, but patients who are listening, who might be interested in starting their health journey in functional medicine, right? And considering being seen as a patient here? What would you say to them? Lindsay, you go first.
Yeah. I mean, I would challenge anyone to start this journey as soon as possible. I mean, even if it's, unknown, it's kind of scary to you, wavering from like the traditional approach or what you've been doing, but I really don't think that you'll regret it. There's just so many more avenues to explore. And when it comes to your health and well-being, if you're not feeling 100%. So there's a lot of information. We have so many resources, so many options. And so, yeah, I would encourage you to start now. It's never too late.
Sarah?
Yes, I would say YOLO. You only live once. Like, let's live your best life. We're here waiting for you. Everyone here at the clinic is great. We understand that people live real lives, and this might be all brand new to you, and we're not here to judge you. We're just here to help you and kind of help you put one foot in front of the other to live your best life.
Wonderful, wonderful. Okay, as we wrap up the show here, I always conclude the show asking my listeners their top longevity tip. So, not my listener, my guest. Lindsay, as my guest, what is your top longevity tip?
This is hard to pick just one.
Well, you can give me two, whatever.
Yeah. I think sleep, I have to say sleep because, like I mentioned earlier, you're not going to be able to make healthy choices or, stay active, or nothing's going to work right if you're not getting the right amount of sleep. So that's one, but also at intermittent fasting, I have found, works really well for me. I think it works well for a lot of patients. Some people it's not the best thing, but there's so much research out there on how beneficial it is for our bodies, and it helps reduce inflammation. It increases insulin sensitivity, improves metabolism. So I think, intermittent fasting, that's right up there for me.
Great. Sarah?
Sleep is also my number one, but I
Everybody
would say
says sleep. I've asked like 150 people this, and like so many people say sleep. Just throwing it out there. But yes, but go ahead. That's because sleep is so important.
Of sleep and naps and all the things, rest and digest, right? Then I would say as number two, pun intended, is elimination. So you've got to get those toxins out of your body. And so many women especially struggle with constipation. So, if you're not moving toxins out of your body, that your body's reabsorbing them, it can cause problems. It's uncomfortable. It's just not a good thing. So, yes, elimination is my number two.
Wonderful. So as you can, I'm sure, gauge from this conversation, listeners, there's so much that we can offer for various concerns. And I think there are just a lot of people out there that had no idea that we existed, that they didn't know we could help their constipation or, their menopausal hot flashes or whatnot. I just think we can almost help everyone, I would say. Very few people would we turn away. So I hope this kind of introduced you to the providers that we have here, so you kind of get to know them and the care that they provide. So before I wrap up the show, anything else you guys want to share that we didn't get to that you want to share, or do you feel like that's a wrap?
I feel pretty good about it.
Yeah.
I think we covered a lot.
Okay. Well, then we'll wrap up the show. So thank you both for coming on the show together and kind of sharing how you've become believers in functional medicine. So thank you for representing the Integrative Health and Hormone Clinic so well. We're proud to have you on our team, and our team and patients love you. So if you're listening in and you'd like to schedule an appointment with any of these ladies or myself, call 319-363-0033 or visit our website, ihhclinic.com. And I will say, with three of us here now, the wait times are greatly reduced, because I think for a long time we had a long waiting list, which was great. That was a testimony to the care we provide. But now there's more hands on deck, so we can get you in sooner than I'm sure you would anticipate. So don't hesitate. Like Sarah said, you only live once. Let's get the show on the road. Allow us to help you on that journey. Thanks for listening.